Karoline Leavitt is in an increasingly untenable position. She is regularly hit with brutal fact checks, and she cannot do anything about it. Her own legacy as a press secretary is beleaguered, to say the least. But at the same time, she's defending the indefensible. Leavitt almost got it here when it comes to undocumented migrants receiving emergency room care. She almost stumbled across the truth, but not quite. Listen to this. I love this clip.
And it is an undisputed fact, a fact that under the Biden administration, illegal aliens were absolutely receiving taxpayer-funded health care benefits. In fact, in fiscal year 2024, Medicaid costs for emergency services for illegal immigrants skyrocketed by 142% from the previous year to $9.1 billion. That's $9.1 billion taxpayer dollars that were going to emergency services for illegals. Between President Trump's last full fiscal year under his first administration and Joe Biden's last full fiscal year, Medicaid spending on emergency services for illegal immigrants nearly tripled. There was an increase of 196% between 2020 and 2024. And I have a chart here for you, and I'm more than happy to email it to you. I'd also like to add, because some were asking dishonest questions yesterday about emergency rooms. In Southern California, according to healthcare professionals in 2023, under the Biden administration, Southern California's, quote, entire healthcare system was being bombarded with illegal immigrants and forcing American patients to endure longer wait times. In Denver, Colorado, the CEO of Denver Health stated that 8,000
Listen carefully, because she almost gets it here.
Illegal immigrants made 20,000 visits to the city's health system in 2023, leaving an uncompensated bill totaling over $10 million. So when an illegal alien goes to the emergency room, who's paying for it? The American taxpayer.
She almost gets it. When an illegal alien, she says, goes to the emergency room, who's paying for it? The American taxpayer. And she's almost stumbling across a really important aspect of this. When anyone without insurance goes to the ER, Americans pay for it. Doesn't matter if they're documented or undocumented. That's why we've been saying for decades, give everybody health care, because using the emergency room as your primary care is really expensive for everybody. Now, you might say, well, but David, that's only because the ER legally has to treat people. Just allow ERs to send people away if they're undocumented or don't have coverage or whatever. Think about that for a second. If hospitals could refuse care based on ability to pay or immigration status, first of all, it lets people die in waiting rooms. Like, it allows letting people die in waiting rooms. You're at the hospital. This is the place where they can do stuff to save your life. But we're going to check immigration status, ability to pay, and just let some people die in the waiting room. That's something, as a rich country, we're going to be okay with. What kind of sick moral code allows that? Someone having a heart attack, a pregnant woman in labor, a kid with appendicitis. If they can't prove insurance or citizenship, let them die in the waiting room. That is a death lottery. That's not a healthcare system. The reason that ERs are required to treat and stabilize people is because before 1986, hospitals actually did dump patients. They would send poor people or uninsured people in taxis to specific public hospitals, or get rid of them mid-crisis. And so Congress stepped in and said, this is the United States of America. If you show up, we must stabilize you immediately and deal with the paperwork later. There's very few moral lines in our system that still hold. That one still holds, and it's a good one. As far as immigration status, think about that. An ER nurse needs to now investigate the immigration status of people. They're bleeding out. When did you come here? Are you from the United States or not? Do you have a passport? Oh, you're having a heart attack? Where's your certificate of naturalization? It's absurd. Hospitals are not immigration enforcement. They're there to help people stay alive. If we start deciding who deserves care based on paperwork, we are not a civilized country. And unfortunately, when these Republicans talk about this libertarian utopia they claim could exist, they are indeed talking about a far less civilized status quo. One more of these clips with Karoline Leavitt. She was asked about the layoffs under the shutdown. Her her answer is not great.
And you just said this is an unenviable choice, that this is an unfortunate consequence. But the president has described this as an unprecedented opportunity to lay off additional workers. He's posted a video likening Rust vote to the Grim Reaper. So which is this? Is this an opportunity to fire more workers or an unfortunate consequence?
Look, the president likes to have a little fun every now and then, and I think both things can be true at the same time. The Democrats have given the administration this opportunity, and we don't like laying people off. Nobody takes joy in that around here, and if you think that, then I think that's very sad. You view the White House and our staff as wanting to put people out of work. Nobody wants to do that, but sometimes in government you have to make tough decisions. Carrie.
It's a joke. The president likes to have a little fun. It's a joke that's not very funny. And when Karoline says nobody takes pleasure at taking jobs away from people, yes, you do. Look at all of the roundups that are happening at Home Depots and daycares. And I mean, you do seem to take joy in taking jobs away from people. That's exactly what they've been doing, and they've been bragging about it. They've been bragging about these roundups. So Karoline Leavitt is increasingly in an untenable position. I don't say this because I feel bad for her. She's chosen to do this. She has chosen, despite the increasingly large cross necklaces that she wears hanging from her neck. And you can see that, boy, did she have a big one on yesterday, the day of this briefing. Despite all of that, she is choosing to continue to lie in this way. Now, we are going to have broader analysis of this on our full podcast. If you're watching a YouTube clip, understand that this YouTube clip is part of our daily 1 hour, longer than 1 hour podcast. You can get the full podcast for free on any podcast app. Spotify and Apple Podcasts are two of the big ones. Get the full podcast. We'll take a very quick break. Fall is here. The nights are getting cooler. It's cozier. Hot baked goods feel like a great treat. And our sponsor, Wild Grain, is the first bake from frozen subscription box for artisanal breads, pastries, and pastas. Everything bakes in 25 minutes or less. No prep, no cleanup. Customizable boxes. They can do gluten-free. They can do plant-based. And right now they've got some limited time fall items. Apple cider donuts. I grew up with these in New England. Pumpkin cinnamon biscuits. Love them. The donuts just come out perfectly, like a nice little crisp edge, warm, spiced center. Biscuits are flaky and sweet. Made the whole kitchen smell like a bakery. Wild Grain uses slow fermentation, which means their breads are richer in nutrients than that which you get at the store. You can really taste the difference, and the fermentation process can even be helpful for digestion. For a limited time, get $30 off your first box, plus free croissants in every box when you start your subscription at wildgrain.com/Pakman. The link is in the description.